Good morning, and thank you for joining us today to learn more about how hospitals are using wellness to tap into new commercial markets. My name is Susan Plumer. I am the Vice President of Sales for Strategic Health Services, and over the next 30 minutes, you will hear from our CEO, Chris Caraminico, how our wellness program, including software, services, and analytics, can identify the health risks of your population and help you design the appropriate programs and services to lower those risks while decreasing care costs of your organization. Next, we will show you how that same wellness program, private labeled, can be used as a catalyst and marketing tool to increase your hospital services to employers in your community as well as to the community as a whole. Data is a critical component in identifying potential new market share as well as market shift. We will show you how we can provide that data in a format that you can then turn that into net new revenue for your hospital. There really are 6 easy steps to building this program. And if you become a client of ours, we will work with you every step of the way and within your time frame. From custom proto build to initial program rollout, all can be done within 45 days. So I'd like to also tell you that we will leave some time at the end for questions and answers, so please feel free to type your questions in on the right-hand side of the bar. You will also notice that there is a PDF for our New Directions hospital brochure, so please feel free to download that during the presentation. And now I am going to turn this over to Chris. Chris?
Great. Good morning, everybody. Good morning, Susan, and thanks so much. It's a real pleasure to be here. I love to do these webinars and help people understand how the health systems that we work with are being extremely successful in building their businesses, their outreach business, and building new products and taking those products to market. So what we're going to see over the next 30 minutes is the definition of the problem. And the first thing is we like to say 25%. And so this 25% problem relates to healthcare costs, obesity, and all of the syndrome that is happening here in America. These are all driving healthcare insurers and employers' costs up. And they're all preventable and they're all manageable. They're mostly lifestyle issues. We look at diabetes, the staggering cost of diabetes and what that's bringing. So for our self-insured employers in the marketplace, they're struggling with how do they manage this? How do they deal with it? Our thesis is that hospitals and health systems are the key and their infrastructure to helping those employers better manage these problems and these costs. So many diseases that we think about are lifestyle related, and they start with choices. They start with choices that people make very early on. And so this is nothing new, but clearly the CDC looks at 1 in 3 adults, or 86 million people, have at least one type of cardiovascular disease. And so what we're looking to do is to train the local employers, instead of looking at insurance companies to help them with their healthcare costs, to look at their local providers. And we've engineered a way for those local providers to make money doing it. And that's what we're going to go through. So what we've figured out is the key is that provider-sponsored wellness solutions is really the way to attack and address these problems. Now, wellness has been around for years, and it has mostly been payer-sponsored and driven from the employer, the insurance carrier or broker, or the payer themselves. And the problem with that is no one wants to relate their personal health data with any of those entities. Yet those very same people will go talk to their doctor or their doctor's office or nurse practitioner about all the kinds of things that are bothering them. And they'll be able to address those issues more readily. So what we see is that patients more likely to communicate with their physician or their local health system than they are with their payer or their employer. And so therein lies the key of why we believe that the normal wellness cycle is broken. And so the traditional ways that wellness has been sold for the last 25 years in the United States we think is fundamentally wrong. We think that hospitals and health systems should be the purveyor of that wellness solution to employers in their local marketplace. And it can be the large self-insured guys, or it can be the fully insured small to medium-sized employers. And what this starts for the health system is it opens up a trading partner relationship with that local employer. We see many of our clients today using wellness strategic lead product to go back and sell other things into that employer base. Things like narrow network products, an orthopedic product, a non-emergent cardiovascular product. And those are all meant to bend and shift market share in their local markets. The employer wins because they get reduced cost and they get the clinical expertise of their local health system. The health system wins because they're able to shift market share and grow their business. And so it becomes, and the employees win because they're more likely to engage with the health system. So it becomes a very significant win for everybody when we break that traditional wellness model. The employers are having these same issues. I represent strategic health on the Georgia Tech Health Innovation Lab board, and we often sit down with local employers here in the Atlanta marketplace, and these are large employers, and they're frustrated that they can't manage the healthcare cost side of their business. Whether they're manufacturing businesses, whether they're retail businesses, they have a great grasp of their supply chain. They can manage their electricity, their energy costs, their distribution costs. They can manage their raw materials. They can manage all those things with great accuracy and great leverage. Their healthcare costs, they can't. These employers are looking for partners. The problem is that most of them don't know how to do it. So a week ago, I was in Chicago, and I happened to be with some of the folks from Boeing. Boeing spends a little over $3.5 billion a year in healthcare. So if Boeing picks up the phone and calls Cleveland Clinic, two guys from Cleveland get on the phone or get on a plane, they fly to Chicago, they meet with the Boeing executive team, and they work out whatever program Boeing would like to have because they have that power. But what if you're a 1,500 life manufacturing group in Rome, Georgia? Or what if you're a 1,700 life distribution business in rural Ohio? How do you command that same attention? Because Cleveland Clinic's not going to return your phone call, but the local health system there will, and the local health system wants that business. So what we've done is figured out how to help hospitals meet the employers on their turf and expand the network. The interesting thing is when we get work with a hospital and a local employer, we see startling statistics. For example, an insured group may have as many as 30% of their members that don't get a primary care physician every year. And so for the employer who's gladly willing to pay for those visits, they get frustrated that somebody doesn't go get regular checkups. And they really get frustrated when that person becomes ill for a preventable disease, a stroke caused by hypertension, cardiovascular disease, or a heart attack that's brought on by cholesterol or other elements. The employer wishes that that employee would just do the basic primary care. The health system has the key to helping that employer solve that problem. Our goal is to bring the two together to make sure that that works. Modern healthcare talked a little bit about providers providing wellness. And the one thing that they talked about most prolifically in the article was the fact that in no wellness program corporately did the modern healthcare found gap in care remediation, identification or remediation was included. And so if modern healthcare calls that out, that's where we've built our business to help those local health systems identify and remediate gaps in care. So those gaps in care could be as simple as absence of a primary care visit, or it could be as complex as a cardiovascular patient that isn't on a statin that should be. But we can tell you that data, and your care providers can go out and bring those solutions to your local employers. Our strategy is very, very simple. At Strategic Health, we build our products, our platform, our technology, and our coaches to enable the health system or the hospital to work with its local employees and then work with 3 distinct markets. Its employees, the community at large, and the self-insured employers in their community. Our goal is to help the health system market at first its wellness services, but then an increasing list of services back into those self-insured employers. We're even seeing today a shift from the local provider who's been doing these kinds of projects for a period of time turn into a payvider, which is a payer and a provider. So a lot of our customers are starting to look at OEMing or bringing out local insurance products and selling that to their local marketplace. Depending on the insurance licensure, there's different ways of doing that. But ultimately, what we're seeing is the local health system getting more active in their community, getting more focused on their local employees and their local businesses and how they can partner with them, and staving off competition. I'm going to give you a few examples. This slide I call our $1 million slide, and we've built our business on this. If you can, for a moment, put yourself in the mindset of the chief administrative officer of a local business, even let's say a local school system. So you have 10,000 employees in your school system, and you are managing prevention, you're managing disease management and case management for all the employees that are on your school system's benefit plan. In addition, you're paying vendors to do that. These could be as many as 3 vendors, it's rarely 1, and those 3 vendors rarely ever talk together. They don't share data amongst each other, and they certainly don't send any of that data up to the local health system. So our theory is that the local health system should be the purveyor of these services, prevention, disease management, case management services, to those local employers. And they should capture that spend that the local employer is using through other third-party companies. And now the local health system, its primary care network, is fully enabled because they now have all the data to take care of and better manage not only the health of those employers' employees, but also the cost structure with which it gets managed. The employers that we work with and the health systems are looking to the health systems to keep their employees healthy. One of our health system partners came out with a logo that said, it's no longer the place to go when you're just sick, right? We want to be the place in town to go when you're healthy. And so they've built a branding and a go-to-market strategy around, hey, if you become really sick, we've got great docs, great facilities, our scores are exceptionally high, our doctors are highly rated, our outcomes are tops, but ultimately we wish you weren't here, and we're going to give you the tools and products and techniques to figure out how to keep you out of the health system. So we know we can take care of you when you're well. We can't take care of you when you're sick. And so that is a major shift and change in local health systems and how they're thinking and working in their community. One of the things that we look at, and I often get asked, is, Chris, this is a new business venture for our health system. What does it mean economically? So we are running a very tight margin. The commercial payers are squeezing us. The public payers are squeezing us. What can we do to better manage that? And how do I find an ROI internally to fund and build and manage this business? And so one of the things that we see are some of the statistics. For example, on average, with our client base, over 250,000 folks, 20% of the employees have not had a primary care visit in over 24 months. Now remember, all of our clients all have insurance plans. And so every single person is well situated to have a paid-for wellness visit or primary care visit, but still some don't. 30% of the females over 40 have not had a mammogram in over 24 months. 52% of the males over 50 have not had a colonoscopy. ever. And so and these are just some of the tidbits that we look at. But what these create is all net new revenue opportunities. So the reality is, if you're not going to the doctor and your payer calls you and says, Chris, I'd like you to go to the doctor, you may not go. But if the local health system says, we're partnering with Bob's Manufacturing, and we want to make sure that every employee is able to get a primary care visit, then the response from the employees is different, and the uptake of the employees is different, and that creates net new revenue for the health system. Here's an example of our engagement portal. So this is the consumer side of our business. We allow private labeling of our products. We don't want Strategic Health to be the brand in the marketplace. In this particular case, we want Kish Health System to be the brand in the local market. It's identified, it's worked with, you've spent millions of dollars and years building your brand in that market. We want to be able to help you leverage that market through our portal. In addition, that portal links to a community, what we call community engagement platform. And so the things that you see on the top left-hand side are consumer applications. Fitbits and Jawbones and Apple Watches and all those kinds of cool things are all integrated and brought into the platform. On the bottom left-hand side are more things of a more clinical nature. And so some of our hospital clients are using things like, we manage hypertension through a program where we give the member a blood pressure cuff, Bluetooth-enabled blood pressure cuff, and we sync that back into our system. Or it could be a glucometer. It could be any one of a number of things that are clinically enabled now, and I'll call them consumer clinical devices. We also have a personal health record. Some of our hospital clients still live in a heterogeneous computing world where they have multiple EMRs. And so in order to meet meaningful use standards, it becomes very difficult for a consumer to go out and have to log into a primary care doc's EMR, a specialist doc's, a hospital's EMR. And so what we've built is a personal health record that's fully meaningful use certified that can be tucked up underneath of the wellness platform. So as you engage those local employers, you can then engage using that personal health record to drive consistency. It's an option, not everybody needs it. We do our claims analysis through MedAI. We can do incentive management. And then our secret sauce is, because we're all healthcare IT people at heart, we can export our data to either an electronic medical record or to health information exchange, however they want to interact with the system. As a hospital, the big question is, okay, Chris, so we have a wellness program. We're bringing that wellness program out. You've helped us build and sell and market that program, and that program has brought us some new revenue. How do we know how to engage with our customers, and how do we know what other things we should be thinking about? And so the reality is that we're going to help you through our tools and our technology identify what are the ancillary products that you should be selling to your employers in your marketplace. And so our analytics engine, our reporting engine can drive and build that recommendation. Let me give you an example. So this happens to be an employer group in Texas. And as you can see here, imagine sitting down with the health and benefits manager at this employer, and you're the local health system, and having a discussion around hypertension. 16% of their employees have hypertension and it's not controlled. And so as an employer, you're incredibly frustrated, right? Because you can go to Publix, supermarkets, or Kroger's, and you can get a pill like lisinopril for free, which controls blood pressure, but you need to get a script to get it. And as the employer, you can't get your employee to go to the doctor to get that script. But as the health system, you can immediately address that problem. And so that's where this joining of data and practical knowledge and boots on the ground and feet on the ground in a locale becomes incredibly impactful to healthcare costs. We talked a little bit about gaps in care, and we looked at what modern healthcare says about gaps in care. Our system allows you to look at gaps in care either at a macro level by disease state, so you can have those discussions with your employer groups, or you can drill down in particular and say, in this case, have the diabetes patients had an A1C in the last 12 months? Have they had an eye exam? Have they had any number of things that we know are part of the treatment protocol? Gap in care remediation, we believe, is the short-term ROI. It's also the boost for revenue for the local health system. Example of another group in Texas where we can see most health systems market their physician services to the general public. And so what we train them to do is to market them to the people that have the want, need, and desire to purchase their services. So for example, here's 9,500 folks who have had a physical exam in the last 12 months. Well, we know that if you've had a physical exam and you're relatively happy with your doc, you're probably not going to change. So the ability to grow and shift market share in that group is very small. But over here, we see 2,700 folks who either through claims analysis or a health risk assessment have self-admitted that they have not had a physical exam in ever in their life, and in this group in more than 24 months. And so that's a pool of people that we should help you market to. And we can identify and help the health system market those services. So whether it's physical exam, a pap smear, a mammogram, a prostate exam, or any one of a number of other gaps, we can help you directly market to those folks. And we bring that data into the SHS platform. And so that platform brings the biometric data that you may do, it brings health risk assessment data, it brings that mobility data or that consumer data that you want. It can also bring EMR data, it can bring lab data, incentive data, and we can sort that and manage it so that you can parse and manage the data so your coaches or our coaches can better address that population. We also can manage all the communication. So whether it happens to be a secure message or a public email, whether it happens to be recommendations, all that stuff can get captured, managed, and enclosed within the SHS platform. We also bring claims data in. So if a coach or a health coach is managing or working with a specific member, they can drill directly into their claims where they can see pharmacy and medical claims to get a better understanding of what's going on with that member. Also, member communication can all get managed. So whether that's printing emails out or printing snail mail letters out, all that can get managed and done through the platform. So at the end of the day, you can use wellness to help your bottom line get healthy, but also become the strategic lead product to sell more and more products to your local employers in your community. Let me give you an example. Here's a local community event that was kicked off this summer. King's Daughter Medical Center in Ashland, Kentucky is one of our great clients. And so together with King's Daughter, they sent a letter out to 126 local employers that were invited to a lunch. And there, the medical center talked about what they wanted to do in their vision for health and wellness in their local community of Ashland. And so King's Daughter, like many of our other health system clients, is under extreme competition. Ohio Health is creeping down from the north, Bon Secours is creeping in from the east, and so there's many facilities that are trying to vie for that patient and that employer population. So King's Daughter said we need to be proactive rather than reactive. King's Daughter is now looking at a local Kentucky insurance company to go out and bring an insurance product that's private labeled. They don't have the balance sheet to manage the insurance license, but that insurance company does. And so they're going to bring a private labeled insurance product to their local employers as well. But it all started through a trading relationship with them. We then sat down with King's Daughter and we looked at the employers in their local marketplace. And we looked at whether they were self-insured or fully insured. We looked at the number of employees locally. We looked at the number of employees on a benefit plan. And we came up with a game plan for how to attack them. I just got word that one of the local banks, Grayson Bank, just moved to the King's Daughter Wellness Program. And so you can see that with a methodical and focused effort, King's Daughter is going through and developing relationships at the wellness and prevention level with the local employers in their marketplace. Every company has a cool client, and clearly the LA Dodgers are our cool client. Most people think of a baseball team or a professional sports team as the 10 or 20 people that they see on the field, during a game. The reality is that somebody like the Dodgers has hundreds, in fact, it's a little over 600 employees that support 24 folks that are on the field. And the 24 folks on the field get all of the best health, wellness, training, body and physique optimization programs that the world has to offer. But the reality is that the 600 other folks represent a very, very significant cost to the LA Dodgers. So the Dodgers knew that in Los Angeles, in that marketplace, somebody that clicks over from pre-diabetic to diabetic costs them an average of $13,000 or more, or a little more a year to manage. And so they went through in a methodical way using our tools and our technology and our healthcare provider partners and figured out exactly who was in that pre-diabetic state. And we started to methodically go out and attack those problems. And so here's the story of Jennifer, who had really was generally healthy, but had gotten, I would call, a little out of balance. So between her physical activity, the foods that she ate, the kind of foods that she ate was creating a problem. So between working with health coaches and being more accountable for what she ate, she took herself from a pre-diabetic state to a normal state. Huge win for the Dodgers, huge win for Jennifer, changed her life personally. One of the things that our hospital partners ask us is, Chris, we are just really, really busy. Whether it happens to be launching new businesses or whether it happens to be acquiring physicians, fighting off competition, we just have a lot going on. Managing an ACO, we just have tons going on. We need help. It's really impossible for us to, although we know we need to do this, for us to summon the resources to do this. So what we've built is a series of customized templates, whether it happens to be a market-based prospect list where we're looking at the 5,500 so we understand who's insured and where they're insured, who the local brokers are, how do we work with those local brokers, to employer newsletters, hospital reseller flyers that can all be private labeled with the hospital's logo. Even employee communication, so the health system can send employee communication out to their local employers about the health and wellness program and what they need to do to sign up. So all these things are templated and built, and they come as part of our package. The benefits are the health system gets increased volume. They get a new revenue stream by identifying and mitigating gaps in care. They get positioned as the place to go for health and prevention, as opposed to, well, if you're sick, you got to go to the hospital. For the employer, they've been spending this money and are willing to spend this money. The difference is they could never find a way to get to that patient and get them to avail themselves of these services. The conversation changes when we're asking the patient to mitigate gaps in care or manage preventative services when you're the local health system than when you're the payer or the employer. So what I want to do now is take a break. We've given you a lot of information, a lot of interesting stories. Susan, I'm sure that people have some questions, so I thought we'd open it up now and take a few.
Sure. Thank you very much, Chris. So in the interest of time, I know that we are at the noon mark, but there were a couple of questions that did come in regarding marketing and whether you had the opportunity to outsource the entire sales and marketing completely to us, which I think Chris covered in the presentation, that we can do as much or as little as you want, all the way from, identifying those employers and the self-funded employers in your market that are your best target, to really being the boots on the ground for you. We do have a very, very comprehensive sales and marketing program, and I will be sending out follow-up information to all of you on that, since there were several questions. There was another question that came in regarding coaching. Can SHS do the coaching for our employees, and can we then do the coaching for our employers? And the answer to that is absolutely yes. We are very flexible and work with a lot of our health systems. A lot of our health systems want us to do the coaching for PHI reasons for their own employees, and then they will do it for their employees as a revenue generating tool. And those coaches obviously send those employees back to their hospitals for services. And we also do provide the training, extensive training for those coaches that you have in your hospitals. So those were really the two major topics. I mean, certainly this is, a high-level overview of what we do, and again, there is a PDF on here for you to download, and I will be following up with you regarding the sales and marketing program. For those of you who are on LinkedIn, you will be receiving an invitation to our group called Hospital to Employer Outreach, and I encourage you to join that group and learn more and get more information real time from us. So with that, I want to conclude the webinar and thank everyone for your time. And my contact information is on the screen now, so you can feel free to contact me at any time. And again, we will be reaching out with you to provide additional information. Thank you.
Awesome. Thanks, Susan. Have a great day, everyone.